it giving you a 3, 2, 1?
Yep.
You're now live. Here we go. Hello, everyone. Welcome to our live stream. I would like to welcome Professors Peter Berman and Max Cameron. And I invited them to this live stream because about a week ago, I heard President Trump say that if I listened totally to scientists, we would right now have a country that would be in a massive depression, as he was talking about COVID-19 pandemic. And I just found myself feeling incredibly curious about that statement because from my perspective, I look to countries like Taiwan, who have in their leadership an epidemiologist and seem to take really aggressive measures with a combination of things, testing and quarantining and masks. And I look to them as a model of science response, and their economy has not been nearly as affected as the US economy. But I am a physical oceanographer. I'm a postdoctoral fellow at the University of British Columbia, and this is so outside my field of expertise. Thankfully, a few months back, I received an email from someone in my department highlighting this, this project that Professors Berman and Cameron are working on. They are leading a project at UBC to, let's see, I have the title here, Health Systems Response to COVID-19. And so what I thought I'd do is I'm going to keep this kind of a short introduction, 5 to 10 minutes. I'm just going to introduce Peter Berman and Max Cameron and then turn the table over to them so they could explain their project. And then tomorrow and the next day, we're going to invite them back at 2 p.m. Pacific Standard Time to talk a little bit more about what scientists are really saying for how to best respond to the COVID-19 pandemic. So who are you? Who are you, Peter and Max? I went on to your CVs and did a little snooping on you so I could share with the world your expertise, which is incredibly impressive, both of you. So Professor Berman, you are professor and director at the School of Population and Public Health at the University of British Columbia. It also looked like you were at Harvard for about 20 years. Is that 20 years about
Even
right?
More.
Even more. Excellent. Still adjunct professor at Harvard T.H. Chan School of Public Health.
Right.
And you've had job titles like lead health economist at the World Bank.
Yes.
Yes. So of all the people I could think to speak to this topic, I look to you as a good source of information.
Thank you.
Max, you have in your specialty box a focus in political science versus health economics, and from what I could glean from your resume, your specialties in political science include specializing in comparative politics, democratization, and separation of powers. Yes?
Yep.
Your grants have these wonderful titles like Revitalizing Democracy and Threats to Democracy and Checks and Balances in Democracy. And then you wrote this book called Political Institutions and Practical Wisdom Between Rules and Practice. And what I'm really excited to hear from you is about your perspective in terms of exactly what you say in that book title, the rules and the practice and this sort of space in between. So thank you both for being here.
Thank you.
Thanks for having us.
I think now, especially, it's just an important time to hear from people like you who are really experts in this field and can share a little bit more clarity of information around this. So if you don't mind, can I just please turn the table over to you to describe your project and what you've been working on in regards to the COVID-19 pandemic?
Great. Should I take the lead, Max?
think so. I think that's a good idea.
Okay, thank you. So thanks very much, Rachel. So I'll try to describe this briefly. I think that Max and I started to put our heads together to think about some of the factors that could explain the differences that we're observing around the world in the way that jurisdictions have responded to the COVID-19 pandemic. And what we found initially, and what stimulated our interest, is I think two sort of widely observable facts. The first is that many jurisdictions actually did many of the same things pretty much around the same time. We had things like border closings and various closings of various public facilities, and strong campaigns to urge hand washing and physical distancing and mask wearing. Differences certainly in degree around, but a lot of the similar things. And if you look in Canada, this was true across Canadian provinces, almost identical in time. Fact number one. Fact number two, ironically, a little less than a year before this event happened, a major study around the world was done on preparedness for pandemics. And almost all the countries and territories of the world were scored in terms of an index based on 140 indicators of their preparedness. And what you find when you look at this index, and it's called the Global Security Index, is that it had almost no predictive value in terms of the effectiveness of the response. The number 1 and 2 countries in terms of preparedness around the world were the United States and Great Britain. China was ranked number 50. Vietnam was ranked number 51. So that raises a question in your mind. Well, if the more or less objective, observable indicators of preparedness don't seem to explain much about the variations that happened, and if the response around the world in many countries was somewhat similar and occurred at the same time, so what's going on? Why are we seeing such different results? So that got us thinking about what we've been calling some of the upstream factors that affect the effectiveness of the response. And our thinking turned to 4 types of things. The first 2 are related to each other, and they're the institutional conditions that countries work with. And by the institutional conditions, we're borrowing some of the thinking that comes out of the institutional economics field, which focuses more on the norms and practices and rules of the game that govern government behavior. The politics, obviously, is around the political, politicians, the political structures. Max's field, I'll let him talk about that. And then we added to that thinking about the way that the health system organizations are structured, especially the public health organizations. Who are they? Where do they sit? Who do they report to? Who are they accountable to? How do they relate to the political powers? And how do they relate to the citizens more broadly? And then we link these together with concepts of governance. So how are decisions taken? And how are those decisions implemented? What are the processes through which these organizations actually carry out their intended objectives? And this is what our project is about, to try to understand these things. We believe that these things matter in a very significant way, both for what governments decide to do, how they decide to do those things, and how they try to carry those things out, and also how they relate to the citizens, because so much of what we're seeing is also a function of whether citizens have confidence or trust in the advice they've been given. And a particular element of this is the science. How does the science enter into this process? And how does the science become used or not used more effectively to advance the goal that almost all governments would say they have, which is to advance the citizens' well-being, right? I'll stop there.
Yeah, no, that's great. What I heard you say was there's a lot of similarities in response, and what you didn't say, but what I'm translating in this is that the ability of any particular government to respond to the scientific information at hand is somewhat related to the structures. Perhaps. There seem to be a few threads there. Awesome. I look forward to hearing more. And you may have noticed I put myself on mute. I am a single parent. My son, I coordinated someone to give him a ride home from soccer. And so he came on and I was anticipating that.
Good. That's
good.
That
Cameo appearance.
Exactly.
And Max may want to add something around the particular focus that he brings to this process.
Absolutely.
Yeah. Sure. Thank you. And thanks, Rachel, for having us with you and for convening this discussion and for your lovely introduction. As is clear from your introduction, I'm not an epidemiologist, although like so many people, I've become a bit of an armchair epidemiologist as I've learned about R-naughts and flattening the curve and so forth. But I'm, as you said, a political scientist, a comparativist. And my area of specialization is actually Latin America. But for a number of years, I've taken a very keen interest in the idea of practical wisdom that goes back to Aristotle, which is really about how do we know what the right thing to do is in a particular situation, especially a situation where there's uncertainty, and know how to do it in the right way and at the right time and for the right reasons. So this is a field often referred to in philosophy as virtue ethics, the capabilities of exercising good judgment and acquiring the character to do so. And so I've been working on that for a number of years. And in fact, the pandemic, I think, provides us with a remarkable opportunity to reflect on the conditions under which we make good decisions, both as leaders or politicians, as well as citizens. The decision, for example, to wear a mask, whether we are to practice social distancing, do we send our kids back to schools? These are really important decisions, and they're in some sense decisions that are political. They're decisions that we make as citizens and that we make as leaders as well. And so I was drawn into Peter's marvelous project, and there's a larger group that's involved in this, where we're doing a series of case studies. Mine are focused on Latin America, because as Peter rightly notes, not only is it the case that in Latin America, as in the rest of the world, the measures or the indicators of pandemic preparedness don't correspond well to the results that we're seeing. And in fact, we're seeing in some cases among the least prepared countries, the strongest responses, but we're not seeing good results in many contexts. Some of the countries that, for example, would appear to have been better prepared would be, say, Brazil and Chile, and they're actually not doing very well at all, or Mexico. Other countries like Costa Rica and Uruguay have done far better. Countries like Peru have tried to implement the best possible mix of policies and have not succeeded. And so we have this sort of interesting puzzle. And the specific piece of it that really interests me, that goes to your question about knowledge and expertise and how science and evidence is used, it has to do with the ways in which we can mobilize scientific knowledge and evidence into the political process and then get the public to comply with health policy directives. So the relationship between elected officials and health policy officials or senior civil servants who have the knowledge and expertise, as well as epidemiologists and researchers and others who understand or are learning about this virus and its spread and how to contain it, and how those two sides, the scientific experts, the health policy officials, and politicians can work together, because politicians also have important expertise, because they have the how-to of mobilizing the public, of getting the public on board. And so you started with this terrible claim that if we listen to the health policy experts, we'll have a depression. What that tells me is that there's a complete failure to understand that it is the job and the responsibility of politicians to find the best possible balance between what the evidence tells us we need to do to control the pandemic, to flatten the curve, but also to weigh against that the need to keep life going, to keep people working, to keep schools. We understand that's important, to make sure that people who have the need for elective surgery, for example, get attention. These are complicated balances. There's no right or wrong way to, well, there are many wrong ways of doing it, and there are a few right ways of doing it, and finding those actually requires judgment and discretion. So science doesn't tell us what to do, but science is essential to figuring out what to do. And then it's up to the politicians to do the work of ensuring that the public gets the message and is mobilized to respond. And I think if you approach it that way, we can begin to unravel the puzzle that Peter has framed, which is, why is it that it seems to be working in some contexts? In other contexts, it's not. And in still other contexts, people are just giving up.
Yeah, and so I hear this sort of three-way street of the science, information, the leadership, and then the trust in leadership. And one question that I have that you haven't spoken to, that maybe we could punt for the next couple of days, is if there is a trust in a leadership that's going counter science. And if that was seen, is that part of the playing field for why there has been divergence in these different countries that seem to be prepared on similar levels, but have had very different responses? So
that's a great question, and there are, of course, politicians who have earned a lot of public support by actually going against what the science tells them, and that would be a fabulous. We could look at some cases of that, but also places where the science has taken the lead and maybe not made the best possible decision. So great territory for further conversation.
Fantastic. Well, thank you both for being here tonight. We're going to follow up tomorrow at 2 o'clock. We're again going to try to keep these as short little missives of 5 to 15 minutes. And I'm really excited. This is really helpful for me, and I appreciate the conversation. So thank you.
Thank you.
Hey, thanks.
All right. I'll see you tomorrow. And
See you
anyone
tomorrow.
who's out there listening, if you have questions, you want to post comments in the chat, I'll be looking at the comments, and we're going to be bringing them into the conversation. So we really want to hear from you, what your questions are, and we'll keep this dynamic alive.
Great.
Okay,
All right.
bye.
See you tomorrow.